Hello, and welcome to another episode of Ask Your Dentist. Hi, good evening. This is Dr. Feras DDS. I'm here hosted by Icon Dental Implant and Sedation Centers. I'd like to discuss the subject of all on four with you today. We are here located at Visalia 918 West Main Street, and we would love to see you. We would love to hear your story, and we would love to serve you with your all implant and dentistry needs. So the focus of our practice is comprehensive dentistry, sedation, in dental implant. We do this with passion, with love and care for our patient. And if you're watching this for the first time, I try to go live once or twice a month at least. If I'm very available, then I try to make it every week. So if you follow this blog, welcome again. And if this is your first time, tell your friends and your family, and we would love to see you here again. Please feel free to email me, ask your question. Um, Even if I'm not your dentist, I encourage you always to ask your dentist and ask me as well. So I'll be happy to help anytime. Um, you can reach me through email, through Facebook, and I want to shout appreciation to all of our page fan on Facebook. Hello, everyone. This is again Dr. Feras DDS, and the subject of today, uh, all on four. The concept of all on four is to place four implants for on one arch and have a hybrid type of prosthesis or a bridge or a denture that go on the top of these four implants. So this has become an option as more and more digital dentistry improve. This option become more available in in my opinion, sometimes overuse, but definitely it's a great option when it's done on the right indication. So if you see now, I want to share with you that my preference is not all on four. I prefer all on X for very simple reasons, um, which is the more we have implant, the more we can get a better support and a better distribution of the forces. However, if we over engineer more than what we need, then this option become more and more expensive. So we all know and enjoy Swiss cheese, and we always use this example when we talk about the upper jaw. For the upper jaw, definitely I prefer more than four implants. So this is where usually we utilize all all on five. In extreme cases, we might need more than six implants. Now, the good news in my office, even though we use more implant and we use all on X concept, we keep the cost the same, about the same like all on four. This is how the upper jawbone look like. So it's tubercular, it has a lot of spaces, so it's soft in we call equality type 2, 3, and 4. So the 3 and 4 most likely what we can find in the upper jaw, and this quality of bone is very soft. That's why we utilize more than 4. Now this is an example of the lower jaw bone. It's like a oak wood, and you can see it's solid. This is the lower jaw. It's cortical. So here, where we can get away with only 4 implants, and that could work well for my patient. So the success rate of all on 4 on the lower mandible is very high. Now, when we talk about success rate, I want to make sure that we're not going to overpromise this concept, because many times the success rate is it's how long the prosthesis stay in the patient's mouth, and many of these is 10 years. So if it's past 5 or 10 years, many times we say this is successful restoration. Um, I'm against the idea or implying for our patient that this is um, could be a lifelong restoration with zero maintenance. I always tell my patient that it's gonna be some maintenance. So um, maintenance is good. It's important to kind of set clear expectation with our patient. Transparency is very important. So when we talk about 4, the concept of 4 come from, just like a table. If you want to have stable table, we have a 4 legs. That's where all of 4 um, concept related to physics come from. Okay, I want to step back and I want to tell you my educational background and my credentials.
Hi, Ayana. This is Alicia Melling, and I got your message about me.
Sorry about that. So I want to talk about my credentials, and I'm a speaker. I teach dental implantology all over the country, and also I do local events for our community to speak about dental implantology. I'm passionate, and this came from the my journey started a long time ago with dental implantology, but also I publish in a peer-reviewed journals. I have my own surgical technique that's also been published. Um, my background in education in dental implantology. I have a Master of Science in dental implantology from Germany, University of Frankfurt. I'm a fellow in the Academy of General Dentistry. I'm a diplomat of the International Congress of Dental Implantology, and also I'm diplomat of the American Board of Oral Implantology. So a little bit about what we do in our practice. We use a face scan to scan the face and set up the teeth based on the position in the smile of the patient. This is example of all on 4. And many times here, I put this example because the patient here does not show a lot of gum. Okay. This is another pictures of a good indication of all on 4. So in my opinion, teeth has to be hopeless to utilize this concept, or at least they have a poor prognosis, and the indication here has become more clear for me. I prefer to save the natural teeth whenever we could, when they can help us in function in aesthetic. So what we do, we actually utilize multiple technology to produce this type of procedures, to practice precision surgery, plastic, microplastic surgery procedures for placing the implant. This is a CBCT scan, um, show the projection of the implant. We utilize 6 implant here for the top, where we have this is the first picture is the indication, the second pictures is the substructure, and final aesthetic crown, individual crown that's customized and placed on the anterior teeth, ultimate aesthetic. Now, these pictures show combination of natural teeth in implant. And you can see here with utilizing natural teeth, we got a good acceptable result and we saved uh, our natural teeth in for this patient in this case. So it's not always we want to utilize the concept on all on four. So it's not a pipeline where all my patients come in and they end up with all on four or all on X type of procedures, uh, and that shouldn't be the ultimate goal. The ultimate goal is should be meeting patients' concern as close as possible to meeting patients' concern, especially in function, aesthetic. When we talk about all on four, we have some limitation. However, if you with the right patient, with the right indication, we can get very nice aesthetic. Um, but I rather always be realistic about the expectation because dental implants are great um, as a replacement of no teeth. They are not great as a replacement of teeth, if that makes sense to you. So what I'm trying to say is dental implant is not the same like natural teeth, and that's why my preference not always to go for all on four for many reasons, but that's one of them for sure. Moving forward, I mentioned about the longevity of all on four type of procedures or all on X. We talk about that, there's a limitation, there's a maintenance requires, and yes, if it's done with the right condition, with the proper care from the patients, we can get great result. And these procedures might last us with some maintenance a lifelong. This is a connective tissue graft, and you can see here if we have that much of a plaque, if the patient don't care about the procedures, we end up with not good result. We end up with some type of inflammation and infection. This is another case where we decided to preserve natural teeth in the front and utilize implant to restore the posteriors or the back area of the mouth. This patient actually, her front teeth just been done by another dentist. So, and the patients work hard to save those teeth. And I was not completely satisfied with the front teeth help, but I respect the wish of the patient, and I always prefer to save the teeth whenever we can. So we end up leaving those teeth and keeping them and utilizing just a normal type of implant and bridge uh, restoration. So you can see here four teeth on the top left. Uh, we only utilize here three implant only. This is another patient on the top with the hopeless teeth, multiple failures, periodontal disease, gum disease, inflammation, where we made all on four type of hybrid procedures. We're working on the lower jaw now with just individual implant to restore the bottom. But the patient here have a high gum line. You can see the transition between the patient's gum and the prosthesis. So we try to hide that line always underneath the lip. If patient has, we cannot hide it with the type of, we sometimes we have some alternative to make that happen. I hope you enjoyed um, this small presentation. If you have any question or concern about this presentation, or if you want to know more, uh, please let me know. I would love to hear from you. And thank you for attending this small presentation. I'm looking forward to hearing from you soon. Give us a call. Our phone number here in Visalia, 559 733-2273. We would love to have you as a patient. We would love to meet you and hear your story. Um, and remember, always ask your dentist. See you soon. Have a wonderful evening. Bye now.